Hey everyone, this is Dietitian Aparna and welcome to my channel Diet and Diet with Aparna. So let's start today's talk by looking at this picture on the screen. So what does this show? This shows the usage of dietary supplements here in America. As we can see that more than one third of Americans they take supplements. That means majority of us who are watching this video are already taking one or the other form of the supplement, and they are mostly in the form of multivitamins or mineral, or in the form of omega 3s or DHA or EPA fatty acids for the heart health. It may not come as a surprise to you that 30% of the American population, which is over the age of 65 years of age, is taking more than 4 supplements. That's a whole lot of supplements, right? So, in today's video, I'll be talking about some of the benefits or some of the important things that we need to remember when we're taking these supplements. So, as we know that all these supplements they come in different forms. They come in the form of pills. They are liquid. They are or powders. They come in, but again, some of them they are focused on only one nutrient. Like it could be just calcium. It could be just vitamin B12, or they can come in combinations like multivitamin, which has like many different kinds of minerals in there, of multi minerals or multivitamins like vitamin A, vitamin B, vitamin C, all of them combined together. So some of the common dietary supplements that are most commonly used here are calcium, fish oil, there is turmeric, there is garlic, there is vitamin D. So these are the most common ones. What we need to remember when we're using these supplements is that majority of the time they are safe, and definitely sometimes they are effective also, and that is the reason they are in the market. But we also need to remember that not 100% of the time they are safe, and 100% of the time they are not even effective. So we need to remember these things. Some of the supplements that have been proven to have the beneficial effects, what are these? I'm going to give you a list of some of these, like vitamin B12. It can help you with the nervous health, like the nerves. It helps to keep the nerves in good health. Vitamin B12 also helps you with anemia. It can prevent anemia because the deficiency can cause anemia. And as most of the pregnant women or the elderly women, they do know that folic acid, it is very important during pregnancy, as it can reduce the chances of birth defects in the kids. And then vitamin D, it helps with strengthening of the bones. And then we have calcium, which is important for the good bones. Others are vitamin C and vitamin E. They are important for the cell. They are important because they prevent cell damage. They are also important for immunity. One of the most common is the fish oil, which is promoted to help with the heart health. But I will be talking more about the fish oil or omega 3s in detail, but it is one of the common ones to be used. And then there is melatonin that is supposed to help you sleep better at night. So, talking about the fish oil, despite the amount of research that has been done on these supplements, there is, especially when it comes to omega 3s, there has not been a lot of evidence that prove that these are effective. This is important, or this helps with the heart health. We also need to keep in mind that most of the studies, when they are done for multivitamins, they won't make there is not enough evidence to prove that they will make you live longer, or can help you with the cognitive decline, or they can lower your chances of a disease such as heart health, cancer, or diabetes. There's not enough evidence on these things, on these diseases in particular. Also, we need to remember that the products that we buy in the stores, they are totally different from the products that are used in the labs for the experimental purposes. So some of the that is why the exact results cannot be may not be replicated when it comes to common people. What is done in labs could have different effect on the body compared to what we are going to buy it from over the counter. And very important it is to remember the multivitamins. Most of the times they do not cause any health risk, but still it is important to be cautious when you are putting anything in the body. Supplements, they may interact with your medication if you have certain health conditions, like what if you have liver disease, or if you're going to have a surgery, then we need to be careful about what we are eating, what supplements we are taking. Some supplements are also not even tested on pregnant women or young kids, or women who are lactating. So we need to be careful about that also. Some of the common supplements that can possess some risk on the body are like vitamin K. It can reduce the effectiveness of the blood thinners. Similarly, high doses of beta carotene, they can have a risk for people who smoke, as it can cause lung cancer in them. Similarly, extra vitamin C and vitamin D, it can cause kidney stones. Taking a high amount of vitamin 6 for a year or longer, it can actually cause nerve damage. So we need to be very cautious when we're taking these supplements. We should not just be buying because they claim to be effective for one thing. We need to also remember that they can also have the side effect. I would say it's always better to talk to your healthcare provider before taking any supplements, because sometimes there is a drug and nutrient interaction, like I mentioned before, vitamin K interacts with the blood thinner. So always talk to your healthcare provider what you are taking, what medications you are taking, what supplements you are taking. Other thing, supplements, as the word says, they are supplements. They cannot replace the food. The supplements are there to supplement the diet. There is nothing that can replace the healthy meal. So eat your food regularly, eat your meals regularly, and use these supplements just for giving that little extra boost. Don't use these supplements as the food, because they are not meant to be for the food. As the word says, supplements, they are just for supplementing, not for replacing. I hope this video was helpful. And again, if you have any questions, I will be happy to answer these. And thank you so much for watching this video. And please don't forget to subscribe to my channel. Thank you again. Have a good one.